Hi, welcome into your dental appointment. So happy to see you today. I'm glad that you're coming every 6 months to have your dental routine, exam, and cleaning. I would like to just review some medical history and information, make sure nothing's changed. Have there been any changes to medications? Any recent surgeries? Good. Any changes to any medical conditions that we need to put on file? Okay, awesome, good. I'm glad everything seems to be well for you. And today we plan on doing a cleaning, the exam, and fluoride. We are not due for x-rays, so we won't do those today. And we're going to go ahead and get you started, okay? Awesome. So glad you're here. First, I'll begin by putting gloves on. We have our mask and our protective glasses on. Protective glasses are on, mask is on, and gloves are on. So we're going to go ahead and get started today. I'd first like to begin with some palpations, just to make sure that nothing feels out of sorts. Gonna relax. Everything seemed normal while palpating. I'm going to hold my hands right here by your jaw, and I'd like you to go ahead and open and close your jaw 3 times. And while we're doing this, I'm going to check the joints and how they're connecting. It also helps to see if they're going into the joint socket, or if there's any popping or any concerns of strain, which could be opposed to TMJ or even possible signs of grinding. So, alright, go ahead and open, close, open, close, open, and close. Okay, so no popping during the check, and I didn't notice that the joint was coming out of the socket, so it is in alignment and doing what it needs to be doing properly. Now, do you have any tension anywhere? No tension. Good, good. So no concerns of grinding right now. I'm going to go ahead and put a bib on you now. Beautiful. The bib is on. I'm going to begin with my thin hook probe, and I will use this in between the teeth and the back to check the gum attachment to the teeth and bone. I'm going to count for the periodontal assessment. Numbers 1 through 3 are a good sign. Anything above that is concern of gingivitis and then periodontal disease. Healthy gums are usually light pink and do not bleed. Gums that are inflamed have a redness and can slightly bleed and can become gingivitis if left unattended, which is why it's so important to not just brush our teeth, but brush our gums, and also to floss in between teeth. When our gums are healthy, then they attach to our teeth in a healthy way. Otherwise, if it's not healthy, then the gums can separate from the tooth, causing bone loss, which makes the gums separate from the attachment around the teeth and can make the teeth wiggly and eventually fall out, and it also causes bad breath. So very important to keep up with your dental health. We're going to go ahead and begin by probing and counting. 3, 3, 2, 3, 3, 2, 2, 1, 1, 2, 1, 2, 3, 3, 3, 3, 2. So as you heard, very good news. 1 through 3, nothing more. So that's very good. We'll go ahead and do the upper teeth. 3, 2, 2, 3, 2, 1, 2, 3, 3, 2, 2. Good, good. So upper back teeth are also attached and very healthy. I'm going to use my short dental pick for the upper and lower front teeth. Starting with the lower. 1, 2, 1, 1, 2, 1, 1. Great. Now let's move to the upper teeth. 2, 1, 2, 2, 1, 2, 1. Beautiful. Healthy gums. I'm going to begin by removing any tartar and plaque, which is what is formed from food particles, any saliva, and minerals that attach to the teeth. A lot of times you'll see an accumulation more on the lower teeth due to our saliva glands and it filling up in like a pool. And also if we aren't flossing as much, then it can cause that tartar and plaque buildup. So we're going to go ahead and just use my crochet pick on the back upper teeth to remove anything that I find. I'm going to head down to the lower teeth. Awesome. I didn't find much tartar or plaque, so I did just remove it from in between the teeth where needed. And what I'm going to do now is focus on the front teeth and remove any plaque and tartar there. Starting on the upper. Gonna head to the lower. Definitely noticed a lot more tartar on the lower front teeth, so I'm going to use my tartar scraper to get that off. I'm going to clean around the gums on the lower area now that I tried to scrape the tartar off, just because some of the clumps did come off and I want to ensure it's clean in there. So I'm going to use my gum cleaner. I noticed a popcorn kernel in the back of the gum area, so I'm going to go ahead and remove that. Let's go ahead and begin Using my long dental pick to get the surface of your teeth, which is the top surfaces here and here on either side. It's where you can see like the crevices and the surface of where we chew our foods. Just want to go in there and make sure there's no food remnants and check for cavities. But actually, before we do that, I will brush your teeth first. Thank you for bringing your toothbrush and toothpaste today. We'll go ahead and use that. We're going to go ahead and begin to brush. Always making sure we're going back and forth in circular motions. Very good. Everything is brushed and polished. I'm going to go ahead and take a look into your mouth to do an exam. See, okay. Okay, so great sign is that we are not seeing anything abnormal. I'm going to use my long dental pick on the surface of the teeth just to ensure that we got all the food remnants. so that looks good. I didn't see any signs of any cavities, so that's a really good sign. I know we're not doing x-rays this time either, so that's okay. Did you want to go ahead and do fluoride? I know we said yeah, right? Okay. Do you prefer the liquid fluoride today, or do you want the varnish? The liquid? Okay. Very low on our fluoride. Go ahead and gargle this. Thank you. Okay, we're going to do one last look just to make sure that everything looks good. Fantastic. You are all set. Thank you so much for being here, and we'll see you in 6 months.